So now you may have heard a lot about what is going on in the schools. Let's listen to some of the commentary in the course of the week about COVID-19 in schools.
It is WASI and all that. Ladies and gentlemen, do not be hoodwinked by President Akufo-Addo and the MPP. Do not buy that lie. It is not about WASI. This government doesn't care about WASI. They don't give a hoot about WASI. This intransigence, their belligerence, you know, in keeping SHS students in schools which have recorded positive cases is to make room for those students to be registered as part of the ongoing voter registration exercise and nothing more. That is it. When they are done with the registration, if they don't heed our call today and close the schools, and if parents don't take the destinies, their own destinies and the lives of their children into their own hands and go into those schools and bring out their children to their homes, when they are done with this registration, mark it on the wall, they will close the schools.
We cannot exchange an examination with the life of our students. I think life is so precious, and we shouldn't wait for 10, 20 students to die before we realize that it is far more important to be alive than to get the grades. So for life, there's no option. So that when they are in school and somebody is not infected, for that one it will be right for them to pass on the virus to their friends who are not infected. So if the issue is mass testing, then they should go on with the mass testing, whether they are going home or they are staying in school. But if they go home and they will infect their parents, then whilst they are in school too, they can infect their friends. Or is Ghana Education Service trying to tell us that all the children in school, all the students have acquired the COVID-19?
And we had about 300 or so plus teams from the national, regional, and districts who are working all through the country. But for the past 2 weeks, we've been out there doing that work. And fortunately, we have been able to make sure that we pick all the issues that needs to be addressed. For some of them, they have said that you can readily address them. For others, you may have to come back and then address them. Another key area as part of ensuring that everything goes well is training and giving information to the teachers and the health and the staff who will be handling, as well as the children. Subsequently, we've done what we call master training, we've done our regional training, we've done our district training. Starting today, the training for teachers and heads of schools and selected teachers are going to run for the next week or two to ensure that we all have the basic understanding and the basic things that we need to do. The monitoring is an ongoing thing. Once we've come and we do our reports and we do the fillings and we fill the gaps and other things, the next round of monitoring will start hopefully next week or the week after. We want to ensure that we, as much as possible, any issues that come up, we are on top of the issues and be able to address them.
Right, so that was Professor Kwesi Opoku-Amankwah. You have heard the Education Ministry, you have heard the Minister of Health, among others, very emphatic that the closure is not the way to go. You've heard also the coalition of concerned teachers. We've had NAGRAT, we've had NAT, all issuing statements asking for one thing or the other. There's also been a parents' teacher association also issue a statement expressing concerns. But when you speak to the parents individually, when you speak to some of the teachers individually, like Ghana Connect did on Joy yesterday, you will find that they are divided. Dr. Koboy.
Yeah, Samson. So let me.
We are seeing the numbers in the senior high schools.
Yes.
How does it look now? Take us through again.
All right.
and then tell us why closure is not an option.
All right, so in Ghana now, we've had a total cumulative of about 26,000 cases, 26,125, with 85% having recovered. We've had 139 deaths, which comes to a mortality rate of 0.5%. And I always like for us to appreciate where we stand in the League of Nations. So our mortality for 0.5 means that for every 1,000 cases of COVID in this country, we can lose 5 people. And Nigeria is doing 2.2%. It means for every 1,000 cases, they lose 22. The US is doing 4% mortality. They lose 40 for every 1,000. Canada is doing 8%. So, I mean, our situation, like I always put it, is one that is inspiring. We are doing our best to make sure that we protect lives and save people from avoidable death. Now, it is important to reiterate some of the very important measures we took as a country before reopening schools. First of all, we made proposals come from all stakeholders that had anything to do with education as to how to do the reopening. So Vice Chancellors Ghana, Tertiary Education Workers Union, NAGRAT, NAT, civil society, all these proposals were received. And then after receiving them, we sat at the table to see how to harmonize and get the best measure for our schools. In fact, WAEC also was engaged to tell the state the things they would like to see in place before allowing students to write their exams. This was a very meticulous process which we committed ourselves to. Now, beyond this, we also had preschool conditions, things that had to be met before opening schools. In total, we had to deal with 18,606 institutions for JHS and SHS. All these institutions, 18,000, were fumigated, both public and private. The population we are dealing with at JHS and SHS is 1.123 million. Let's say 1.3 million people. JHS, SHS, both teachers, teaching and non-teaching staff. So Samson, it's a huge operation where we have to make sure that all these people had at least 3 reusable face masks. All these schools were given Veronica buckets. And forgive me, but I have to mention a few things just for people to appreciate the logistical input. Across Ghana, 64,700 Veronica buckets were deployed at the cost of about 32 million Ghana cedis. Thermometer guns, 48,000 pieces at the cost of average 48 million were deployed across the country. 5.2 million face masks. All these were done, and liquid soap and all of that. Now, as we speak, as at 13th July, that's end of Monday. Normally, it comes in at Monday, end of the day. Then they put the figures together. We had 161 confirmed cases in the over 1,000 SHSs across the country. 161. Now, so the question I ask myself immediately is that, is it news to record a case at a school? Something. And let me, by the way, say that when I hear people say that close the schools or we have to let the kids go home, I'm not in a hurry to combat those people. I want to take the opportunity to do some education. Because more often than not, when you give people education, they calm down. Immediately, you have a situation where, as a country, we've done about 340,000 tests. 7% has come out as positive. Now, what it means is that on the face of it, or based on the data, our prevalence rate, average percentage for 100 any people you meet is 7% as a country. So when you go to any office, or you go to the market, or you go to the streets and pick 100 Ghanaians, you are likely to pick the 7, you can add +3 or -3. You can pick 2 people who are COVID positive or 10 who are COVID positive. It falls within the statistics. So now, that's why I wasn't perturbed or surprised, let me say that. Perturbed, maybe a little perturbed. But I wasn't surprised when I was told that when they did some contact tracing at multimedia, they picked 5 cases. Assuming you have 100 workers here, it means it's 5%. It is because of that assumption that a colleague by you might be positive without showing signs and symptoms. That is why you are wearing the mask and I'm also wearing the mask. We are not wearing this mask for fashion. The enemy is invisible. You can't see it with your eyes.
Right.
But preparing or protecting yourself comes with results. And so the idea is that if I have COVID and I'm positive, normally the first 3 to 7 days is the incubation period, the period that I can get sick. That 3 to 7 days, I can infect others. In fact, the studies have shown that for the first 11 days, even if you're asymptomatic, you can infect others. So if I am positive and I wear my mask, the risk of having the viruses in the air is reduced with the mask. Sinakukubaku has reduced its risk of inhaling the viruses by wearing the mask. So after 14 days, if I remain asymptomatic, I would have recovered by the definition, by not having any symptoms and also not being able to infect others. But within that 2-week period, the two of you wouldn't have contracted the virus because you engaged in a risk reduction behavior. So the kids were giving all these masks because as a country and as a globe, we are all aware that once people step out, their risk is higher than in their bedrooms. And so if you record a case at a school, when you say, why did we record? Then that one is not too good. But when you ask, what are the measures? Then it is a genuine one. Are we enforcing the protocols? And I've seen Sinabaku holding the guidelines. I also have it. I don't want to bore you.
And you find that some of the parents, their main worry is actually about lack of communication by the school administration.
Absolutely.
They hear that my child or my ward in Accra Girls has been infected. They hear it not through a nice communication channel. They get it through the media. They are seeking information about it, and everybody is quiet in the school.
I get it.
So they naturally get agitated. Then they come to the school to demonstrate, so to speak.
Samson, we had a very meticulous arrangement in terms of reporting the case. First of all, the school nurse would liaise with the housemaster, with the head teacher, communicate to the district director of education and the district director of health, and inform the parents. Then after all this, take measures like isolating, just like you did at multimedia, disinfecting, treating the person, tracing contacts. All these have been put in place. You realize with the Accra Girls situation that most of them were done. The kids were isolated, sent to Ghana East. You have contact tracing, 314 people traced. Their results came, further people isolated. But most of the time, if you are dealing with human beings, you can have 100 arrangements. Not all will be fully executed. So we realize that the information flow, like you are saying, was not as was put on paper or agreed with them. So what we've done, the president set up a subcommittee, my modest self, I'm part of the committee, to make sure that the arrangements are actually enforced and executed, and to monitor the situation.
I think that's the problem. The enforcement.
Yes.
The monitoring. Look, I'm driving to court every morning, and I'm seeing students, and after court, that's afternoon hours, I'm seeing them holding hands, acting as if there is nothing to care about. Meanwhile, they have been handed masks. So I practically stop and ask them, why are you not wearing your mask? They say, oh, I'll wear it. And I insist they should wear it. And they wear it.
I thank you for stopping and telling them to wear it. You see, I think, like I was saying, because you are dealing with one of the biggest logistical operations in terms of deploying all these items countrywide, and you are also depending on officers of the state. When I say officers, people who are like teachers, directors, disease control officers. There are over 330 monitoring teams across the country. But really, something, once you are depending on individuals who might have different levels of efficiency, levels of proactiveness, you get, look, we were in a conference call, the head of CHAS, he's the headmaster for Tia Madia. In fact, I don't know whether because he's the head, he had followed the protocol so rigidly that they have a COVID team made up of his deputy head teachers, the accountant, the security, like a complete one. And he told us in the conference that all their colleagues have been told to activate this committee. So, the monitoring we've put in place is also helping, so that whenever you identify any insufficiency or weakness, quickly you compel them to make sure the right things done. And one admission they made, which you have also made, is that the students wear the mask when they enter the classroom. Immediately they have some 1 hour or 30 minutes of break. When you meet them, the mask is coming off. When they close, for those who are day students, the mask is off. No government like they have in US, any place. No government can win the war alone without cooperation from citizens. And by the way, let me conclude by saying that when Sami Jemfi goes to the NDC headquarters to give press conference, his risk of getting COVID virus, the coronavirus, is higher than if he had stayed at home. Now, those who came to pick and cover the event, they are exposed. If they had stayed, they are more exposed being at the press conference than if they had stayed at home. The point I'm making is that it is when you have more or less intrinsic bias that you forget that you are virtually working as a political party.
Okay.
Whilst you ask other entities to be at home.
The most important question people need an answer to is that from the very start, I had Bright Simmons on this platform, and we're discussing, we look at other countries when they were trying to reopen. We discovered that they had protocols. And the protocols included everybody in the country knew if one student tested positive in a class, the class will be suspended. If, say, 4 or 5 students in the school tested positive, the entire school will be shut down. What is our protocol?
Samson, thank you very much. Let me say that, like I said, the current positivity rate for our data is around 7%. I don't want to go into the figures for someone to say, oh, Dr. Koboy says it's even less than 0.01, what we've recorded, so it doesn't matter. Every positive case is important. And that's why for each case, we isolate, treat, and contact, trace, and all that. I mentioned it at Asempa the last time, and I was misquoted as saying that when we have 15%, we'll close down the schools. The point I want to make is that when you are managing such a situation, it's a dynamic one. Each case will be assessed on its merit. But there are things you look out for. And this disclaimer should be absolute. I am not saying it's a government policy, but from the public health point of view, the 2 things you normally look out for is the number of cases you've had in terms of percentage compared to your national statistics. That's a first point. So that if you are getting 7% positivity for the country, and in a school, you are getting 30 or 40% positivity, it means it is a red flag. That's how they call it. Red flag meaning that you need special action. The second one, which I mentioned, which was not quoted, which is really the most important, is that are most of your cases symptomatic or morbid? So if you pick, let's say, I thank God, almost all the 55 cases at Accra Girls, virtually all of them were asymptomatic, just like your 5 cases at Multimedia. But if you pick 55 cases, and more than half are morbid. Morbid means that requiring oxygen, being put in the hospital, it requires extraordinary steps or actions. And so these are things that those managing the situation will be looking out for. And I say this so that we don't send the message that this government is saying no matter what happens, even if, and God forbid, all kids are dying, they should stay in school. That is not the position. The position cannot be rigid, just as the virus itself is not rigid. The virus is a fluid one.
All right. So it will be dealt with on a case-by-case basis, depending on what happens. And we don't have a particular protocol as in published, so that as we have heard of other places, if 1 student in a class gets infected, or if 2 students, or if 3 students in a class, that class is suspended. Then if, say, about 10 students in a whole school get infected, then they shut down. We will assess the situation on a case-by-case basis. More importantly, whether it is morbid or it's a question of asymptomatic people.
But Samson, forgive me, just a second to say that, 1, who picks a case or who you present to is part of the protocol. So we have a detailed protocol from suspicion to confirmation to actions post-confirmation. All that is well detailed. What I'm saying is that it is the assessment of the school's state that will determine actions like either re-entrenching protocols, aggravating restrictions, or total closure. We must be careful, because if we don't say it well, people might think that as it is now, there's really no protocol. Should you get a case in a school, you are lost. There are fine, meticulous, detailed protocols from the nurse to who to call, the hospital that has been.
Let me get some judges' views, and then Kukuba also. But a question has been asked. If you can look at it briefly. And there's another surgeon who is the head of Kofanoche, who is also bringing the same situation. But we have seen that companies have shut because of COVID-19.
Yes.
Why is that principle not applied to the schools?
So the answer is very simple. There's a good reason why multimedia didn't shut down, but let's say people quote both shut down. If you get a case and you don't get closer to the experts to be advised, your interventions might be either under, below what it is, or above. The point is that Ghana has a Ministry of Health. My boss was positive. The place was taken through the protocols, disinfection. I was still going to work. The place wasn't closed down, and I'm still negative. So the point is that some institutions took actions without reference to the experts. What the policy government has put in is that if you get a case, get to those who are managing, they would advise you how to.
But when you talk about workplaces here, like in multimedia, and I'll confess, as most of you heard me, from the very start when the COVID broke, I came in, sat here, I asked myself, am I safe? Then I had to take the decision that it has to be a personal safety protocol. Now, we are adults here. We are not children. The children find themselves in a situation where they cannot conduct themselves like we adults will do. So the comparison doesn't exactly work. And then, like you mentioned, sometimes I feel like the media is even one of the frontline, frontliners when it comes to COVID management.
You know what? Let me state this.
You can stop. You can stop school. But and you don't lose anything. But this one you don't have to.
The science. Let me say this: if you are following the trajectory of cases in the world, the presence of the virus, there is absolutely no way this virus will vanish from the global population in the next 24 months. I'm saying it, in fact, absolutely. So it means for the next 2 years, there will be cases of SARS-CoV-2 in the world. And when I say the world, Ghana inclusive. Now, what it means is that should you take a position that you want the virus to be out before anybody moves in terms of school, work, and all that, it means your kids must be home for minimum 2 years.
You don't want the virus to be out. You want to get to a stage where you have a good handle over the virus, or it would have minimized. And we were told that, in 18 months, we would have gotten to a manageable situation.
We as a government have decided to commit resources and logistics into creating a safer environment and ensuring personal safety for kids before putting them in school, so that they can finish their program, write their exams, and move on to the next stage. We don't want the presence of a virus in the world's population to determine their future. Any country that is allowing its people to go to work or allowing them to move out of their homes are doing so knowing very well that the risk, like I always say, is higher. And by the way, why is it that the NDC would still go to Arabaka and make press conferences? Will not stop working as a political entity. Okay. But would like the schools to
Sam George, let's have you briefly on this subject, and Kweku will also make a brief statement on it. Let's hear you. Why do you support teachers and other parents who are calling for a close down?
Samson, I want to appeal to your innate sense of judgment and fairness, which I know is established. In your studio, you have two people who are voting for Nana Addo Dankwa Akufo-Addo. They stated that publicly. I'm the only one voting for John Mahama. Wow. Okoboy has spoken for 25 minutes on this subject. At least give me some fair time.
No, there's a reason he speaks for as long as he did on this subject. If we came to the GBC matter, you will speak more than he has to, because you have better knowledge on the subject than he would have.
Thank you.
So please go on.
Well, I just wanted to establish there are two voters for Nana Addo in your studio. You haven't voted yet, so I can't determine where you vote. Anyway, the point needs to be made here. Dr. Okoboy spoke about protocols that have been put in place. He speaks about Veronica buckets. I'm sure he'll be the first person to admit that those Veronica buckets themselves could become petri dishes for the spread of COVID if they are not managed. The protocols around the use of the Veronica buckets are not managed properly, because an infected person touching the taps would actually infect every other person who subsequently uses the taps. Again, he makes reference to face masks that have been distributed. What face mask? We're told N95 face mask by the PRO for the Ministry of Education. The evidence does not support that as the truth. In fact, it was cloth masks that were presented. And everybody knows that with the cloth mask, after you wash it a number of times, its efficiency, given the size of the virus, is affected. Again, we have a Children's Act. And the Children's Act enjoins government to act in the best interest of children. Are we saying that the best interest of Ghanaian children today is to subject them to the mental torture, first and foremost, even before the health pandemic of COVID? When you see students, for example, in KNUST Senior High School, who had to hold their own colleague as he died on campus, or the Accra Girls Senior High School students who know that their colleagues got infected, and the mental trauma that is putting them through. The point has to be made here that, for me, if we had a proper continuous assessment regime, like Nigeria is doing, like Kenya is doing, it would make sense for us to graduate these children using their continuous assessment and not just one examination. Again, let us look at the basis of the legislation. When you look at the legislation that's been put in place governing this is EI 134. If you read EI 134 on educational institutions, which is Section 2, and you look at Section 2.2, the operative word there used is may, not shall. And I'll read. It says, notwithstanding paragraph 2.1, universities, other tertiary or training institutions, senior high schools, and junior high schools may open and operate to accommodate the following students on the specified date. And then it goes A, B, C, D, and all of those things, it uses may open. It means that we need to ask ourselves, have we put in place the right framework that is going to allow for the students to be taken care of? You made reference to the fact that the government tells us they put in place protocols. What happens to these children when they go into the dormitories? In their dormitories, they do not wear face masks. They mingle in their dormitories. Again, you see the junior high school students who go and come every day and board trotro and are at the risk of infection without necessarily observing the protocols. Even with the boarding houses, not all teaching and non-teaching staff are residents on campus. They go home and come back on campus, and the possibility of infection is there. I honestly hold the view, like the NCC does, and our COVID-19 response team has put this out, that look, the best way to go about this is for government to be proactive by doing mass testing. If we mass test every child in school, yes, it is expensive, but if we want to put the children in school willingly at all costs, the best thing to do will be to mass test the kids and teaching staff and be sure of the status of everybody before they are kept within the confines of the school premises. But all of this discussion we've had, I honestly do not see the justification for the junior high school students in particular who have to keep going and coming every day and exposing them to the risk that they've been exposed to. Samson, we need to ask ourselves as a country that when we say we're listening to the experts, what have the experts actually said to us? What are the Ghana Health Service and the 4 health organizations that recently issued a statement? What are they saying to government? What is the National Council of PTAs saying to government? What is NAT and NAGRAT saying? What are the teacher unions themselves saying? Who is government listening to? Government is it's engaging the experts and listening to expert advice and engaging in stakeholder consultation. All the stakeholders involved here, parents, the children, the medical practitioners are all complaining and saying that, look, this is an unnecessary risk we're putting the children through. And honestly, Samson, I know that you have a kid in senior high school. I don't believe you've allowed your kid to go to school because I've seen how particular you are about the COVID protocols. And I know you won't subject your child to such risk. I asked Mr. Vincent Esefwa, the PR of the Ministry of Education, a direct question on another platform, if he would allow his child go to school. He couldn't answer that question. And I know you won't allow your child go to school given the current protocols because those protocols do not adequately provide protection for your child. Like has been said in other platforms, it's better to miss a grade than to dig a grave. Government must be sensitive to the plight of the Ghanaian child. And so let's be minded by this, even as we go about talking about protocols that have been put in place and saying that we've done the right thing. Even Dr. Okoboy, in his own submission, admits that the protocols put in place by government are not sufficient enough to take care or prevent the spread of COVID, because he admitted that these kids walk around and they are not always wearing their face masks. If even as grown-ups, the parents of these kids who work in government institutions, the grandparents of these kids who are justices on the Supreme Court, We do not believe that the justices of the Supreme Court or the managers at BOST will be able to observe the protocols adequately enough. And so we suspend the courts. We shut down the offices because of COVID. And we think that our grandchildren and children will be smart enough to observe the protocols. Then the logic on that from government is really rich.
Okay, let me just make a point there, bring a point of information. The courts have been very reluctant to shut down, even under the lockdown. So you may have heard one circular or the other, but still they insist that the court should continue to operate. And you keep referring to me. Of course, I've not made it a private matter. The law you read, the EI, says the schools may open and that the children may return to school. I have spoken to the Education Ministry, and they say that they don't want to encourage too many of the students wanting to opt not to come to school, but to take other options. But if you have a peculiar situation for your ward or your child, straight away you talk to the school administration or you write to them nicely for a good arrangement with your child or your ward, and they can go to school. Perhaps just go and take the exam or setting arrangement that fits them. So the law is permissive. It says the school may open and the children may return. Look at your circumstance and exercise your option. I, as someone who has responsibility for someone in SHS, I've exercised the option appropriately and dealt with the school in the interest of my the child that I have responsibility for. Okay, so Kuku insists I should give the time to you guys to talk, but say something. Say something.
See, you know,
you see, there appears the teacher unions. If you have watched, it does appear they are unanimous on this matter that shut the schools unless the children go home. We have a statement by parents association, so to speak, who also say shut it and let's go home. Some ask, why can't you do like Nigeria? They say the school year for 2020 is lost. We are not doing WASI. We understand Kenya. There are other places where the school year has been declared lost. Why can't we do the same?
See, a quick one. There is a National Council of PTAs. Mm-hmm. Well, my checks with the GAS resulted in a certain conclusion. The credentials is of doubtful validity. Apparently, they are not part of the scheme of affairs of the GAS. I'm told whoever is handling it has tried to seek recognition. He has not yet had it. So he really doesn't speak for any PTAs. GAS apparently deals with the PTAs of the individual schools. And that's how things should be. He's a Ghanaian.
How about the teacher unions? What do you say about that?
I was just moving one step by step. The teacher unions, very credible ones, with integrity, they were even consulted relative to the reopening, the roadmap. I've seen documents to that effect. And our people I respect hugely. I will not underestimate anything they say. But when they made a statement to the effect that there were no PPEs in the schools, did they give us specifics?
Just a few schools. And once the ministry's attention was drawn to it, they quickly moved in and supplied.
Yeah, did they give specifics to the schools? Did they name the names?
No, we don't find it there.
Yes, it worries me.
No, but they gave a list of things that remain the fact.
No. Give specifics. First of all, don't forget they are not the administrators of the schools, but they are on the ground, so they will have evidence. Give specifics. If you are not going to communicate that thing to the people who are managing the process, but you want the whole world to hear, including the media, just give specifics. Because I have followed up on some instances, and I've seen whale bills signed by directors, regional directors of education, relative to supply of the logistics. Whereas if you go on social media, you see this school or that school doesn't have. But I've seen And sometimes it depends on those managing the supply system. Okay? It depends on those things. So, see, those bodies, the credible bodies, I think must change the mode of communication relative to those managing the process. You know why I say this? There's so much fear being generated out there by some sections of the society. This is a novel pandemic, we know. It comes with some apprehension. So if you play on the keyboards of people's emotions, particularly parents' emotions, it's chaotic. The protocol, if I'm wrong, Okuboy can correct me, that if a student gets positive, a test positive, is the particular student's parents that must be informed. People expect that, no, you should call the entire PTA and tell them. It has its own implications. So we, the media too, when we pick that story and we blow it out there, it creates fear and panic.
No, but it is the students in the first place who hear it and then send the information out there.
When it's
and they get panicky, like Sam George says. They get panicky. They don't have the state of mind to do what we expect them to do in school.
Yes.
You don't think so?
We have a level of responsibility to exercise.
Okay.
As for the source, I'm not even prepared to blame the students. If I'm a journalist, I would want to know.
Of course.
So if they hear anything, they might not be sure. Don't forget that they would hear something, no medical evidence that what they have heard is true or not. That's why if you are told or I'm told, I have to be very responsible how I manage the news.
Right.
Or if I put it out there, it creates panic, it creates fear. Because
Obviously.
there's that element of emotion, sentiment, everything involved.
Okay.
We're all parents. And it's true. You feel immediately a bit, fearful.
All right.
So I believe that this is a new situation we are confronted with. If I check the records, the way the roadmap was put out, the consultations and engagements that were made, fantastic. But operationally, there certainly will be challenges and difficulties. It is how we all manage the communication that will be able to resolve some of these matters. That's the way I see it.
All right.
Samson,
Yes.
this,
Just a minute or two, and then we take a break and return to deal with the other issue.
forgive me, but people like Sam George and his people didn't want the schools to even reopen. So he can say he has a perception of what? Poor state of mind.
It was not only the NDC like NDC that didn't want the schools to
I
reopen.
acknowledge that.
And I think sometimes we should be careful about certain things because people in the NDC are citizens of the country.
No problem.
Okay.
I just, because of that intrinsic bias,
All right.
because they are a political party that were against the reopening.
Why this is even a political issue? Like,
All right, okay, he is convinced. But you see, there's a video I've seen from Accra Girls when they brought those 7 students that had recovered. It will amaze you. I got goosebumps when I watched. You could see that these were students who were more than ready to welcome and reintegrate their colleagues and were celebrating like soldiers that have gone to war and won the battle. That is the state of mind.
And it helps to kill stigma.
Exactly. You could see them shout the arrival of the bus, running to the bus to pick their friends and bring them back to school. Look, mass testing. No country in the world, if you appreciate the dynamics of the virus, would invest in testing everybody. 800,000, a population of 1.3 million. If you test all, you can get about, let's say, 5,000 cases. Out of the 5,000, less than 1,000 will be symptomatic. You would have spent hours going after people that are low risk. What is done everywhere is to test either those who are contacts or 2, those who have symptoms that fit in the case definition. And by the way, Ghana has done 340 tests. It's more than about 3-4 countries in West Africa combined. I mentioned the last time, Nigeria is doing 807 tests per million. Angola is doing 304. Egypt is doing 1,003. We are doing over 10,000. It's only South Africa I've seen that has gone ahead of Ghana with about 30,000 tests. So the testing regime is one that is impressive. We can do more. But bottom line, nobody should create the impression that all parents, and this is also important, senior, anytime I see a parent who expresses worry, there are 2 things. Immediately I know that I need to give more information because insufficient information on the dynamics of the virus is a foundation for panic and anxiety, which is true for all people. So we are not in a hurry to contest or fight people who say, why not close the schools? We have to give more education so they appreciate what is happening. By the way, the students who had the virus, either they brought the virus from their communities that they came from, or picked the virus in that environment.
That's right.
Two things. Now, those who want to go for, let's say, their kids, the risk in the population is not any lower than the risk in secondary schools. So we must see it as a national risk, which will take personal precautions to execute. In Nigeria, people have said, why don't you go like Nigeria? I don't want to say it's the lazy man's approach.
Okay.
But not opening the schools means that they wouldn't need to invest in all these things.
All right.
And Germany, let me use soccer to conclude. You see, when all leagues stopped, one country started playing, but with some measures to reduce risk. And later what happened? The others followed. They followed, learning from the measures put in place by Germany to reduce risk. And so that is the way to go. The fact that a particular country refuses to, let's say, reopen schools doesn't mean that it's the best way to go.
Of course, we have been told about other countries which are also doing what we are doing.
And Samson,
so
I listened to an interview from health workers. These are health workers from Gaist, where we have our COVID center. They said initially, when they were told to be volunteers for treating, managing COVID, they virtually ran away. They didn't want to be part. But after training and education, now when they hear that a case has arrived, they run to the case. Okay. It's the same thing we need to do for all parents. And I can assure parents that this government is going to put in place, is going to ensure that all the protocols put in place are enforced rigidly so that their children finish school and finish in time. They've done about 3 weeks now. It's about 5 to 6 weeks to go.
All right.
The same measures that have taken us through the 3 weeks will take us to the end. And the KNUST incident is unfortunate, it's being investigated, but we should be careful not to put that in a COVID-related death. We should not mix the issues.
Okay. Thank you very much. We take a break here, except that we also had to point out that some of the parents were livid when they got the information that politicians were allowed access to their children when they were denied access to their children. That, for the parents, really hurt them. And some of them send us messages personally, very angry about that kind of situation. We'll take a break here. When we return, we'll ask whether GBC will win the fight against the Communications Ministry to reduce its channels from 6 to 3.